Samuel C. Raj. And may I request Dr. Jerry to please come forward, and Dr. Samuel C. Raj will moderate this session.
Thank you, Chaplain Deepak. As much as too much pain is a problem, not having or not feeling pain is a big problem too. So wherever you go in the CMC hospital, you keep seeing Paul Brand building, Paul Brand block, and Paul also mentioned about Paul Brand. And the biggest discovery Paul Brand made was the importance of being able to feel pain. And Dr. Brand came to CMC in 1946, and in 1953 he facilitated developing the Karigiri Leprosy Research and Training Center. So today's speaker is Dr. Jerry Joshua. He's director of the Karigiri Hospital right now, and he's been with leprosy treatment or care for the last 35 years, isn't it, sir? Yeah. And he specializes in treating patients without sensation and doing tendon transfers, soft tissue reconstruction and all. So I'm sure he'll talk to us a lot about the pain of painlessness. Dr. Joshua.
Good afternoon. We've all been hearing about pain and its usefulness or its problems and how we have to deal with it. Am I audible to the last? Yeah? Fine, thank you. Okay. Now we'll be dealing with the pain or the suffering caused by painlessness. There are many physical diseases, physical disorders that cause this kind of a problem, leprosy being chief among them. And now we have diabetes, and then we have spinal injuries, spinal trauma, and very many problems that cause painlessness. I don't know, some of you may be familiar with one of the James Bond movies, you know, it's called, I think it was The World Is Not Enough, where the villain is one who does not feel pain. And he is able to do many things because of this, but actually if you see, it's not possible because pain causes a certain amount of destruction. I'll just show you the pictures first and get over all this unpleasantness, and then we can go on to the discussion, okay? Now you can see this, and without the sensation of pain for many, many years, it could become this. I'm showing you a very late stage disease. I mean, this would be a person who would have had painlessness as a young man. I remember in a hospital in Vadathorsalur, I'll just take off the unpleasantness for a little while. As a doctor in Vadathorsalur, we had some patients who had congenital absence of pain. And there were a couple of boys who used to have ulcers on their feet, so we used to immobilize them, so they used to sit on their wheelchairs. And we had a ramp for the hospital vehicle to come into the building to load everything for the village clinic. And they would race down the ramp in their wheelchairs and suddenly break at the bottom. And both of them would have races with each other. And their hands were in a poor shape. And no amount of us telling them, and no amount of the nurses catching them, and I've even seen nurses whack them, nothing would stop them because they enjoyed this. And finally, they ended up with loss of fingers because they did not have pain. They were not just using their hand, they were abusing it. They were abusing it. Okay? So usually such people with congenital absence of pain do not live to be beyond 23, 24. They have dislocations of their hip, they have dislocations of their knees, they have all kinds of problems. Okay? So this can become this, and this can become this. in the absence of pain. Or even in the absence of pain or in the absence of sensation of the cornea, it can result in blindness. So these are some of the things that we usually see in places where we specialize in leprosy. And increasingly, we do see these things in diabetes. But of course, diabetes doesn't go through all these stages because of its other complications. We end up hastening the process by amputations. So, how do these damages occur? These damages do not occur because, okay, I have put direct injury as the first option. Direct injury we are all familiar with. We all are familiar with getting injured. Okay. You know, in our houses, we have small rooms and we have a bed, and all furniture moves just enough to stub your little toe as you go around the corner. Just moves that much to trip you up. Okay? And you would have noticed that first you stub your toe and just you don't immediately feel the pain. You feel a sudden jarring numbness, and the pain comes in a little later. That's as much as it takes to, what do they say, transduce and transmit and then modulate, and finally it comes into your consciousness and you have the pain. So that is direct injury. But very often, direct injury we are all aware of. But there are the constant gentle stresses of life, repetitive gentle stresses. You see, imagine if you were to look at each other or you were to look at yourself at the moment, none of you is sitting with your weight or your weight shared equally on both sides. You are sitting on one side, and after 5-10 minutes of listening to me, then you'll begin to shift. You'll begin to get restless. You'll shift to the other side. That's because you have a certain amount of discomfort, a certain amount of pain because of the lack of blood supply to the skin in a certain part of the body, which is being compressed. The skin and the soft tissue is being compressed by some bone there, and you will shift over to the other side very shortly without even knowing it. And many of you, if you do not shift, after about an hour, after listening to this talk, when you get up, you will face the consequences of having sat on your sciatic nerve and compressed it nicely for a long time. Okay, we are all familiar with the pins and needles that we have, and we won't even be able to stand on that foot for some time. That's because there has been a lack of blood supply for a long time, and now the blood supply is coming back, nourishment is coming back, and so you're doing this. So we get that sensation. So if you just imagine, I'm standing here in front of you on my right leg. Let me imagine that I have a problem of a damage to a nerve in my left leg. I will stand on my right leg for about 5 minutes, talk to you, then shift over to my left leg. And then, from my left leg, I don't get any impulses going back up. Okay. You might think that the solution could be standing on both feet, but none of us stand on both feet, not unless we've been in the army and they've trained us to do it. Okay. But then in the army, they train us to do a lot of unnatural things. So now I'm standing on my left leg. I don't get impulses coming back up to my spine telling me that this is getting to be uncomfortable. The skin under my foot is not getting the blood supply that it needs because my whole weight is on it. And so I stand here and go on and on and on talking. And I find that people with 1 foot anesthesia actually go in for an amputation much, much, much earlier than people with both feet problems. Then you have this repetitive gentle stress. I'll just keep the microphone down for a minute. Can I just? Yeah. And I just want to demonstrate because there is tissue damage. So as the tissue gets damaged, you get pain sensations shooting up. The same is true of walking. All of us, we walk in the mornings, we get up and then we have to come for this workshop. We walk with what we call the 1-2-3 gait, the heel strike, the foot flat, and the propulsion. So all of us go like this and we propel ourselves forward. Okay? So this is what happens in the beginning of the day. Towards afternoon, we are a little tired. We've had our lunch. And so then we begin to shuffle. We begin to drag our heels. Okay? I don't think many of you can see me. Sorry, I can't demonstrate it. I should have had it on screen. We begin to drag our feet. And towards the end of the day, when we are tired, when our feet are paining, we tend to move, take short steps, and so we don't have to have the heel strike, mid stance, propulsion of gait. We just move with our feet like this. But people with loss of sensation do not protect themselves like that. They continue with the 1-2-3 gait, morning, afternoon, evening, because they don't have the pain. And the skin under their feet has lost its sensation. The sole has lost its sensation, S-O-L-E. And so they continue to walk and damage their feet. So it's not just the constant stress, it's also the repetitive stress. So it's not that it has to be traumatized. You know, it's not that I go willingly and touch something hot. Everybody knows it's hot. Nobody is going to put their hand on a candle or a lamp or a Petromax lamp or anything like that. It's just the activities of daily living that have resulted in those horrible deformities that we have seen. You know, the different parts of the body have different thresholds of pain. If you take the cornea, the conjunctiva, it's about 0.2 grams per square millimeter. Pain in the skin of the forearm is about 20 grams per square centimeter before you begin to feel pain. Pain in the sole of the foot is about 200 grams. Pain in the fingertips, I'm talking about pain. The fingertips are very, very sensitive. They are more sensitive to touch than any other part of the body, but to pain, they are not as sensitive because they need to take in a lot of trauma. Most hand injuries occur in the hand, and most hand injuries occur in the fingers and the fingertips. How does this trauma go on? How does this progress? You can see here a picture of a person with sensation on the left side. The person has been walking and either has been walking on uneven ground, and so the foot has pronated or supinated, and immediately the person has a pain. Some ligaments are stretched. The person has pain. The muscles of the thigh and the calf, they give way. They don't jerk into position. They relax, and the patient stumbles. Okay? But here we have on the right side a person who has the same kind of trauma while walking, but that person is unaware and is continuing to walk with a normal gait, with a normal sensation. The person is totally unaware that there is an injury. This is what happens when there is loss of pain. The person continues to walk. The person can even have fractures. The person can have tears of the ligament. We have a name for it. We call it Charcot's joints. We call it Charcot's foot. And the person can just continue to walk their way to an amputation. They just don't realize it. Very often, the people who see them don't realize it. The only thing that the person will see is a swollen foot. The person has no sensation and so will not feel the pain. And unless they go to a clinician and the clinician feels the warmth and knows that it is inflamed, it won't even be immobilized. Here are the On the left, you see, it's just a illustration from one of Dr. Paul Brand's books. You see the amount of weight, the weight of that person concentrated on a larger area and then on a small area. So that's perpendicular forces. And then here, of course, you see shearing stresses. Shearing stresses are friction forces that happen, and both forces act continuously, constantly when we walk or even stand. Direct trauma is very rare, but can happen. Sometimes we would have, if some of you have been wearing soft footwear and have been walking in irregular, not on the usual roads and pavements, or even there you might have picked up a nail or a thorn in the footwear, and every time you walk, you feel the pain. Then if you turn your footwear over, you will find that there is a thorn or a nail sticking into it. You might have pulled it out. But not so a person with loss of sensation. That person only knows that he has a wound. He does not know how he or she got it. Unless the examiner, that is the person who is treating them, asks for their footwear, looks at their footwear, turns their footwear upside down, and pulls out the cause of the thing. So these are the things that happen when a person has loss of pain. It's the pain that is not there. There are people who, can pick up hot coals. They might even do it as a trick to show you, okay, I can do this. If small children have this loss of pain, they immediately try to show off and say, see, I can do this, I can do that. Everything becomes competitive, And so hot coals are picked up. At homes, when serving food, people pick up vessels. If they have loss of sensation, they'll pick up vessels, keep it like that. Even serve rice for their loved ones with their hands, which is acceptable at home in some homes. So they might even dip into hot rice or hot vegetables or just with their hands and serve. And so these are things that can happen with people with loss of pain sensation. Okay? They can hold a cup of coffee or a tumbler of coffee, and of course, smoking has come down these days, I think. We don't see so many smokers these days, but in the early days when people used to smoke a lot, this would be some of the injuries that we see. Not the thumb usually, it'll be between the index and the middle finger. The burns between the index and the middle finger. These are all activities of daily living. These are not just trauma. They are direct trauma, but they are all activities of daily living that cause this kind of trauma and injuries. This is the direct trauma, yes. The one on the left doesn't usually happen because usually people are aware of it. It's something that we exaggerate, saying that it happens. But usually people are aware. Even they'll use a nail that is longer than the breadth of their thumb when they hammer it in. And it's very rare for someone to get that kind of an injury. But the other kind that you see on the right side for laborers, they can get with splinters, slivers in the handle of instruments that they hold. Carpenters usually get such injuries because they have a lot of shearing stresses between their hand and the instrument that they hold. And of course, all of us are familiar with this activity, turning a key in a lock. All of us are familiar with the times when the key will not turn. So we exert more force until it is painful. And then we realize this can't be done. Maybe it's the wrong key, or the lock and key has to be changed. But if you have seen people with loss of sensation, it becomes a kind of a shame not to be able to turn the key in a lock, and so the people become very competitive, and then they go and try to turn the key in the lock, and you can have your PIP joint dislocated if you had the loss of pain, and this could be one trauma that occurs. Problems of the eye, loss of sensation of the cornea. All of us blink about 20 times, 15 to 20 times per minute. But if we do not blink, there are problems. Very often, even though many of us have sensation of the cornea, I think many young people would have, traveled on two-wheelers, or the older people will remember traveling on two-wheelers without a visor. Okay? Helmets, yes, maybe not, but I'm talking about the visor. If you have traveled by a two-wheeler, motorized two-wheeler without a visor, you would have noticed that you have to keep your eyes open, you can't afford to blink, and the air is rushing at you with a great speed. And later on when you stop, because you have ignored it for so long, because you're not concentrating on your eyes, and you've ignored the pain, you've ignored the discomfort. You've been looking ahead because things are rushing at you and you have to stay focused. After you stop, you will find that your eyes are watering very badly and your eyes are irritated. And so you'll be rubbing your eyes, there'll be a lot of tears. All this has to be wiped off. But people with loss of sensation to their eyes can actually go blind because they do not blink. There is no stimulus to blink. The stimulus to blink for each one of us is the air moving in front of our eyes, and that is enough to cause discomfort or even pain on the cornea and the conjunctiva. And so we blink. And when we blink, we squeeze the lacrimal glands, the tears go in, and then they go into our nasolacrimal ducts and back into our throat, and we swallow the tears. So this is the usual cycle. And so all of us do that to keep our cornea transparent about 15 to 20 times per minute. Those of us with glasses may blink a lot less. Those of us without glasses will blink a lot more because there's a lot of movement of air around us. It's very evident when we are traveling by two-wheelers. But people with loss of sensation of the cornea do not blink. They do not have a stimulus to blink. Added to that, there is the problem of lag of thalamus, which is the inability to blink. And so people do not, even if they want to blink, they cannot blink. So this is a good recipe for blindness. And this can happen in leprosy very often. And so you are left with opacity of both eyes so that the person can't see. For people with no loss of pain sensation, there is the reflex response, withdrawal reflex, when the hand comes in contact with something hot, even before they perceive the heat or the pain. They withdraw the hand first. The pain comes later. Stubbing the toe at the end of furniture, I said that. And realization of the hurt a few instants before the pain is felt. Sometimes we have trained ourselves to ignore it. Like for instance, if we are carrying if we have picked up a tumbler of hot coffee, or even in the paper cups, one cup can be very hot. Or if the cup has a leak, you'll get the burning sensation. You don't drop it. You can control your response. You just look for the nearest flat surface, keep it, and then wring your hands, then wipe your fingers, and then later on pick it up very gingerly at the edge, or maybe use another cup, or wait for it to cool before you touch it. So these are all everyday experiences. These everyday experiences are what are denied to people with loss of sensation. Okay? But we can control our response to the pain. We don't immediately just drop it. We hold it. Suppose you're holding an expensive cup or saucer in your hand. You're not going to drop it. You're going to wait for the nearest flat surface, keep it, and then only wipe it. All of us give our hands for the painful needle pricks. Earlier on, we used to have the tips of our fingers pricked for blood samples. Now, of course, everything is IV. And accidental slivers going in during carpentry work goes unnoticed. And Paul Brand talks about one soldier who was in the trenches in World War II, and there was an explosion, and he had a fracture of both bones of his leg. But he saw another person who had fallen down. One of his comrades had fallen down and could not come to shelter. So he crawled out ignoring the pain, he crawled out, went over, and brought him to safety. And in those days, penicillin was recently introduced, and when they were all hospitalized, this person used to receive his penicillin shots during the day. But in the night, he refused to have his penicillin shots and used to cry. And when Dr. Paul Brand spoke to him and found out what it was, he said that out in the battlefield, there were so many things going on. There was the noise of explosions. There were other people who were in trouble, and he was also in trouble, but he could ignore the pain. During the daytime, there were so many of his comrades were in other beds next to him. He could ignore the pain, but at night time, when he was to receive his penicillin shot, everything was silent. There was no other there were no other distractions, no other sensory input, and there was only one sensory input: a nurse with a needle and syringe. And that made him scared because he could not ignore it. It was the only thing that was happening. So pain can be ignored voluntarily by this gate control theory. You may have heard of it being spoken. It's crowding of other sensations to relieve the pain. In fact, we even say transcutaneous electrical nerve stimulation to relieve pain because it crowds the area with other sensations so that the pain sensation is dwarfed. There was this boy called Namo who was working with Dr. Paul Brand. And he had lost his sensation of his hands. And in the New Life Center in CMC, he was asked to do a lot of work in the carpentry department where protective appliances were being prepared. A lot of research was being done. And this boy, one day, while demonstrating to Dr. Paul Brand, injured himself while he was working. He dropped his instruments and ran out, crying. And Dr. Paul Brand went after him and then asked him, "Why are you crying? We can fix this. You know that these things are done." And so he said, "I am suffering in my mind because I cannot suffer in my body." He did not have pain in his body. And because of that, he was disturbed. And he was suffering in his mind. There's the story of Raman, who also went to the New Life Center. And from there, he asked for permission to go home because he wanted to show his people that he had a certificate saying that he was cured of leprosy. And so he went home, and he was accepted back because of his certificate. And in the night, don't know what happened, the next morning, he found that he had a wound on his foot, and it was bleeding. So he wanted to find out what happened in the night. So the next day, he sat up with a Petromax lamp on next to him, and he started reading. And he found that a rat had come to bite him. So he chased the rat away and continued to be awake all night vigil to see that the rat doesn't come back to bite him. And by 4 o'clock, the book dropped, he fell asleep. And when he got up the next day, there were blisters and burns on his hand. His hand had slipped down and had come in contact with the Petromax lamp, and he had burnt his hand. And so he came back to the New Life Center and he said, "How can I ever be free without pain?" He was without pain, but he needed pain to be free. That was the sensation. That is what painlessness did to these two people. In those days, many people thought of leprosy as bad flesh, rotting flesh. But actually, Dr. Paul Brand and others worked out the thing that it was nerve damage. It was the absence of pain. And it was because of gentle, repetitive stress damaging living tissue, gentle, prolonged stress damaging living tissue, that people were getting these injuries. And it was all because of activities of daily living. Nothing extraordinary, nothing like mountain climbing, nothing like, say, banging your hand with a hammer. When they found that people in the New Life Center were using their limbs, very often these people started using their limbs, using their hands and legs with some amount of care. When Dr. Paul Brand went to Carville in the USA, the people there found it very difficult to accept his ideas, but later on they did accept them, and they started to look for ways in which pain signals could be, the people would know that their limbs were being damaged. So they introduced things like if the pressure on the hand was more than, say, so many kilograms per square centimeter or so, there would be a beep. There would be an electronic instrument which would beep. But they found that when tasks were given to people and they had to perform these tasks, task-oriented people did not bother about the beeps. They just wanted to finish the task. And so they wanted to actually do something that would give them pain. So they found that in the axilla, most of these patients, they had good sensation. So they fixed the contraption so that when you were exerting a lot of pressure, when you were exerting a lot of stress on your hands, when you turned a wrench, if the force was more than so many kilograms per square inch, you'd get a mild electric shock in your axilla. And so he found that one of the mechanics, Dr. Paul was watching one of the mechanics work there. He brought his motorcycle in, he wheeled the motorcycle in, put it on a stand, and then he started using the wrench to open the engine. And as he did that, this person suddenly jerked back. And Paul Brand knew that this man had got an electric shock, and so he had mild electric shock and he had moved back. So this person very calmly unbuttoned his shirt, switched off the battery, buttoned it on, and then went on to do his work. And Paul Brand says the realization there is this person had a choice. Pain does not give us a choice. It happens. The body does not give us a choice. And pain is a signal that demands attention. It cries for attention. Of course, there are different kinds of pain. Some of them just whisper to us. Some of them talk to us normally, but some just shout. And when they shout, it has to be heard. But here was a person, so they could not give a substitute for pain that demanded attention and would be obeyed. They only could give a substitute that could be switched off at will. And therefore, that experiment failed. And the persons and the people continued to work despite the fact that they were having these tissue damage. So they were not, there was no sense of feeling. There's no sense of self. This hand is not me. It doesn't have pain. Therefore, it's not me. It's a tool that I can use to do things. Okay? Like, I think, in all academic circles, people believe that their bodies are made just to carry their brains around so that they can go to different places and say what they need to and learn what they need to and go back. Okay? So it's not a question of self. It's highly academic. So it's like that. There's no sensation in the hand. It does not feel like a part of me. It feels like a tool to be used. It is not self. It is not me. So I'd like to quote one of my favorite poems by John Donne. It says, "No man is an island entire of itself. Every man is a piece of the continent, a part of the main. If a clod be washed away by the sea, Europe is the less." Okay, you must pardon him. He was English, so he was talking about Europe. "As well as if a promontory were, as well as if a manner of my friends or mine own were. Any man's death diminishes me, because I am involved in mankind, and therefore never sent to know for whom the bell tolls. It tolls for thee." So if the bell tolls to signal a funeral, It is not somebody else's funeral. It is my funeral. And that is why we need to respond to pain with sympathy, with compassion. So, I've just talked about the painless substitutes for pain, and then the painful substitutes for pain, the electric shock. And there it was realized that this is a problem of choice, because pain should not give you a choice. Pain is a protective sensation, and if you value yourself, then you have to respond to pain. Because the problems of painlessness are what I showed you in the first few things. It can happen to any one of us. It's not that it happened to somebody. If we do not have pain, that's the progress we take. Very often we find people with children with loss of sensation. Children with loss of sensation of their feet. Like, you know, if you call a child who's sitting there, come here, the child is not going to walk slowly in a dignified way. The child will skip, hop, and jump its way to us, because children have a lot of energy and they have to waste it. Okay? Whereas as we grow older, we become more dignified, basically because we have less and less energy. Okay? And children, when they have when they have painlessness, they end up with amputations by the time they are 15, 16, 17 years old. 20-year-old people who have painlessness end up with amputations by the time they are 40, 50 years old. And by the time my diabetes catches up with me, I hope I'll be gone before I lose a limb. Right? So that's it. It's a sense of self. If it does not pain, it is not me. Okay. Thank you.
Dr. Joshua, yeah. Thank you for taking us to this fascinating world of pain and not having pain. Anybody has any questions? She asking? No, okay. So, you know, this place is, this conference organized by Chaplaincy, and the space is full of spiritual saints also. So is there a spiritual parallel to not having pain? It's like, for example, it's not only leprosy patients who do not have pain. There is in the New Testament, there's something about the withered hand, Jesus making them well. And we have these patients coming with the puttur kattu, and then they lose sensation in the hand because they had very tight bandaging. So is it possible to lose your spiritual sensitivity and so destroy yourself? I was just thinking, do you have anything for that? So all the chaplaincy students are here, so. Joshua.
I gather that you're asking
Yes.
me the question. Sorry, I'm out of my depth in that.
Yeah.
But I think what you said is right.
Sensitivity spiritual?
I think what you said is right. We can draw parallels, but I don't know how.
Yeah. Well, I think it's possible because you lose sensitivity to pain. As pain, you can lose sensitivity to sin.
Actually, that poem, when we lose that poem that I said about John Donne, unless we have empathy or sympathy for the other person, unless we put the other person first,
Correct.
which is what Christ was always doing, and I think so. Unless we put the others first, we are not going to feel that way about soothing it. So I think. When we have pain, we try to crowd it with sensations by rubbing it. So if you have pain here, the other hand rushes to control the gate for pain and give all kinds of other soothing sensations. So I think it's natural that we do it in our bodies, and I think we owe it as a community to each other to care for each other.
Yeah. Dr. Stanley, yeah.
Now, the Bible does talk about God giving us a heart of flesh rather than a heart of stone.
Yes.
And that heart of stone can happen for any one of us, because when we become insensitive, that repeated insensitiveness makes our heart
Correct.
heart of stone.
You lie once, you feel bad. Second time, you feel not so bad. Third time, and you don't feel at all. So I think maybe there's other things about seared conscience that Paul talks about is where your conscience is dead, and so you don't have any sensations. That's a problem. So we should also probably work at maintaining that spiritual sensitivity through God's word, being close to His Holy Spirit, and walking in His way. Yeah.
It's quite a difficult thing. I mean, I can see that and weigh that, very often when it comes to, especially when it comes to patients' bills. It's very difficult to have a heart of flesh.
Yeah. Anyway, thank you for that fascinating talk, Dr. Jerry. Yeah. Any more questions? Anybody? Yeah. Yes.
Thank you so much for a wonderful presentation about pain and painless pain. Really, I thank and appreciate Chaplaincy Department for your wonderful arrangements, and all the sessions were very inciting and thought-provoking sessions. I thank God for your wonderful arrangements. And I would like to add another aspect. I think we forgot to discuss last 1.5 days. We discussed about the different dimension of pain, sociological, theological, psychological, and some other aspects. But what about the cyber pain? Last 1.5 decades, we are living in a digital world. So the online world, public shaming is a commodity, and public humility is an industry. The person who could get more clicks, get more Google advertisements, and get more profits. At the same time, another side, a person suffering goes through some certain painful experiences. Some person committing suicide. This is what's happening in the digital world. And we need the reorientation and have to revisit the realities, reorient the young generations to sense the pain in the painless digital world, I think. Thank you.
Yeah, okay. Dr. Jerry, anything? Yeah. So thank you very much, Dr. Jerry, and God bless you.
Thank you. Thank you.
Thank you, sir. I've been doing this for last 1.5 days, so just bear with me for one more session. So, on behalf of the floor, we want to acknowledge your presence. Thank you so much for leading us into a very meaningful session, sir. So, we'd like to honor you with a small memento. May I request Dr. Praveen to please come forward and to do the honors. To Dr. Jerry Joshua to wrap the shawl and to present the memento, please. And to Dr. Samuel for moderating the session. He is a former head of HLRS department. Thank you so much. Thank you so much, sir. So, we have 15 minutes of break. Okay, so now without